So when we talk about a second hair transplant procedure, when does that come into play? Is that something that's planned beforehand or after an initial procedure? So in general, we do every hair transplant procedure as a standalone procedure. So we create a very natural aesthetic hairline, and the balding or the thinning areas are addressed in a natural aesthetic fashion. So everything is done as a standalone procedure. However, there are some reasons why some people may want to do a second hair transplant procedure and the timing for that. So in general, I would wait at least 10 to 12 months after an initial procedure before considering a second procedure. And the reasons why you may do a second procedure is that there may be some areas that are balding that we were not able to address on an initial procedure. So you're only able to cover a specific surface area. And for instance, if someone has thinning on the front, the top, and the crown may not have been addressed on an initial procedure. So on a second procedure, you may want to address the crown and add some more density elsewhere also. Some people may be really happy, don't want to extend the coverage, but they just want to go in between the previously transplanted hairs and make it a little bit more dense, which you can only make it as dense as possible on an initial procedure. So that's another reason why some people may do a second procedure to add increased density or to increase the coverage area that was transplanted. So these are two very good reasons. Another reason why to wait, especially if we were doing an FUT procedure, is that you want to allow the scar to completely heal. You want to give or allow the scalp to have its laxity restored, and those factors will play into how a second procedure may be performed. So this is something we discuss. A lot of people don't necessarily do a procedure at 10 or 12 months, but they may wait several years, their natural hair may thin further, and then they want to do another procedure to add more density to fill those areas in. So various reasons. This is something we discuss in a consultation, and it's something that we do see a lot of, so it's something that I'm very familiar with.